So our first session will be is titled, hold on, Subversive Disability Justice Education, Spoken Word Poetry as a Bidirectionally Humanizing Pedagogy for Nursing Students and Disabled People. This will be presented by Dr. Sabrina Jamaluddin and moderated by Tess Kriegner. And Tess will introduce herself and Sabrina. Thank you.
Hello, my name is Tess Kriegner. I am a white young adult with short brown hair and glasses. I am invisibly disabled, and I am a current senior undergraduate nursing student at the University of Michigan School of Nursing. This fall, I'll begin my PhD in nursing, focusing on sexual violence, victimization, prevention in the population of adults with intellectual and developmental disabilities. I'm the founder of Disability Justice at Michigan and the lead editor of Accessing Disability Culture Anthology. I am honored to have worked with Dr. Jamaluddin through the Access in Nursing Research Group, and I look forward to introducing her. Dr. Sabrina Ali Jamaluddin is a health humanities nurse scientist, disability justice scholar activist, and spoken word poet. Dr. Jamaluddin completed her PhD in nursing with a certificate in disability ethics at the University of Illinois, Chicago, where she explored the use of spoken word poetry as a form of critical narrative pedagogy to educate nursing students about disability, ableism, and disability justice. Dr. Jamaluddin now serves as a postdoctoral researcher in UIC's Department of Disability and Human Development, where she focuses on developing engaging anti-colonial pedagogic strategies and community-based interventions that work to dismantle ableism in nursing education and practice. Dr. Jamaluddin is Paul K. Longmore Institute Emerge Disability Justice Fellow. She was named a 2024 Equity Minded Nurse through the AARP and Robert Wood Johnson Foundations, and she is the founder of Disabled Nurse National Solidarity Collective, a rising grassroots organization for multiply marginalized disabled nurses. Dr. Jamaluddin's long-term goal is to found an interdisciplinary, applied public humanities healthcare equity center in a university that confronts healthcare inequity, violence, and oppression, and promotes liberation, humanization, and belongingness for patients, students, and practitioners.
Sweet. Thank you so much, Tess. And hello, everybody. Thank you. It is an honor to be here. I'm going to share my screen with you all. Okay. Now we need slideshow. Got it. Okay. So hello. Hello, everybody. My name is Dr. Sabrina Ali Jamaluddin. My pronouns are she, her. For a visual description, I am an Arab woman with light brown skin, brown eyes, and dark brown curly hair, wearing a brown cutout sweater with a necklace that says Sabrina in Arabic, a black and white kufiya around my shoulders, and there is a gray wall and the bottom of a picture behind me. So my presentation will be on subversive disability justice education, spoken word poetry as a bidirectionally humanizing pedagogy for nursing students and disabled people. So for positionality, I am an Arab disabled queer woman of color, registered nurse, spoken word poet, and health humanities nurse scientist. I completed my PhD in nursing and certificate in disability ethics from University of Illinois, Chicago, and I am now finishing up my postdoc. I will be presenting some findings from my qualitative descriptive study on disability justice education in nursing, exploring spoken word poetry as affective pedagogy, which was funded through UIC's Institute for Research on Race and Public Policy, as well as the Tom and Sherry Mendelson Nursing Student Research Award. So I think a lot of people here know that one way ableism manifests in healthcare is in false assumptions on disabled people's quality of life, which harmfully impacts triaging, medical futility decision-making, genetic counseling, medical resource allocation during times of resource scarcity, so on and so forth. So the discrepancy between healthcare provider belief about disability and disabled people's actual lived experiences of disability warrants the exploration of innovative pedagogies which humanize, center the voices of, and situate disabled patients as agents and experts of their own bodies and care. So spoken word poetry is embodied performance poetry that centers the stories, voices, and lived experiences of marginalized people through justice-oriented, anti-oppressive processes of critical education and liberation. So the purpose of this study was to explore the praxis of spoken word poetry as a critical justice-centered methodology for advancing disability justice consciousness in nursing students. This was a qualitative descriptive study that explored UIC BSN student perceptions of and attitudes towards an hour-long non-traditional pedagogical intervention that uses narrative-based spoken word poetry contextualized in nursing as a tool for disability justice education within a professional nursing 1 course of 112 students. More specifically, it consisted of 30 minutes of traditional didactic critical disability studies content, so disability versus impairment, social versus medical model, ableism, person first versus identity first language, medicalization, infantilization, and disability justice. And this was followed by a 5-minute disability-focused spoken word poem, and then that was followed by 20 minutes of a dialogical debriefing. So students could apply the didactic knowledge to their interpretation and discussion of the poem. So without further ado, let's jump into the first spoken word poem, which was the content of this intervention. I like to give a content warning. This delves into trauma from experiences of ableism related to mistrust of disabled people with non-apparent disabilities and the manufacturing of disability through medicalized violence. Audio warning, spoken word poetry is loud and it varies in volume and pacing. There is a QR code here, which will take you to an access copy of the lyrics if that is helpful for you to read along, but feel free to do what is most accessible for you. Shut your eyes and listen, read along, etc. So this poem is called I Wish I Knew How It Would Feel to Be Free. Okay. To the man who approached me after I parked in my accessible spot, hatred painted your face with transparency so I could see your every thought. She ain't blind, she can hear just fine. Doesn't look like anything has incapacitated her mind. She can walk in her body, looks pretty aligned. She's clearly not disabled. So who does she think she is parking in that spot? He thought, looks like a lesson needs to be taught. He got a cousin in a wheelchair, so this must have really got him distraught. Finally, an opportunity to show some resistance like a white man's first boycott. You felt so inclined to speak on behalf of the divine and all of mankind to tell me that I'm disgusting and that I should save that spot for somebody who actually needs it. Thank you. Thank you. Thank you, sir. Oh, thank you. Thank you for making me feel like a piece of shit, so much so that when I got home that day, I couldn't help it but sit and cry to my mother, regretting that I did not lift up my shirt to show him the mural of scars that the surgeon had painted on my skin, regretting that I did not force that man to listen to my story, to hear my allegory about how a doctor in a white coat said the only way to fix the achiness from the curvature in my back would be to realign my spine like a medical carpenter, with my body being the furniture. The words of the surgeon had been cultivated with precision like a lying politician with a charismatic audition. 3 1-inch turned into 3 5-inch incisions, the minimally invasive technique that the surgeon said would have me up and walking around the mall in 3 weeks left me paralyzed in bed for 3 months. 3-hour surgery lasted 6. 2-day stay turned into 7 with 36 pills a day. Morphine shot up my vein every 8 minutes. Couldn't even take away an ounce of the pain. Blood sucked out my body like a vampire through a JP drain. Had a 2-liter blood transfusion, inebriating my body with a stranger's thick red liquid like Cabernet. I wish that man could have heard how 16 years of my life had passed, but it was not until my nurses removed the bandages, unmummified where I was crucified, that I ever saw my dad cry. I woke up from the anesthesia on a midazolam high, asking why does it hurt to breathe? Lie after lie had escaped through the crevices between that surgeon's teeth. In literature, it's called sarcasm when you say the opposite of what you mean. Hyperbole, it's a form of verbal irony like the smell of blood that intoxicated my nose. Tyranny, my body became a casualty of a capitalistic society. My lungs became incarcerated behind the 2 titanium rods and 18 screws that now line my spine. They became the bars of my body's jail cell, where every breath, even shallow ones, felt like someone was using a knife to scrape out my flesh. I wish I knew how it would feel to be free. I wish I could break on me. I wish I could say all the things that I should say them loud, say them clear for the whole round world to hear. I wish that man could have heard how 6 months after my surgery, over 500 lawsuits broke out against the surgeon, revealing that he had been purposefully messing up patients' backs, performing double to triple the amount of surgeries, attaining big-ass money stacks, funding mansions with private cul-de-sacs and Cadillacs, and hospitals were silent because, man, oh man, did they love those kickbacks. But house arrest gave the surgeon a panic attack, so he fled the country on a private jet to save his able to breathe. I remember after each appointment, I'd sit in the car with my mom and scream, tears flooding like the Red Sea. God, how could you do this to me? I've never been religious, but desperation got me down on my knees to pray and plead. I couldn't quite see how this could happen merely because someone was greedy, thirsty for money, and the manifestation is manufactured disability. In summary, I took a year off to get a revision surgery, had everything taken out and put back in properly, and the minute that I got out, it no longer hurt to breathe, unincarcerated underneath, but still suffocated by society's misperception of non-apparent disability whenever that part of me sneaks into the realm of visibility based on the services I still need. I just hope you listen before you judge the pain that you can't see, and understand that conversation about identity is a much more effective means of getting answers than trying to see the unseen. I wish I could share all the love that's in my heart. Remove all the bars that keep us apart. I wish you could know what it means to be me. Then you'll see and agree that every man should be free. Okay, content warning. The next slide has images from my experiences with the surgery and disablement that I usually show my nursing students after the presentation. So I'm gonna go to this now. So the first image is the 3-inch incisions, which are not actually, or 3 1-inch incisions, which are not actually 1 inch, and a bone growth stimulator for a 1-level fusion. There is not even a gap of 1 inch between some of them. There's an image of my revision spinal fusion that cut through my back from the top to bottom with a very bad allergic reaction to surgical glue. There is an image of me with the JP drain that I mentioned in the poem, as well as images of me with my bone growth stimulator for a 12-level fusion and a walker, because the rehab process was definitely not 3 weeks. So you can see how this narrative can stimulate dialogue on disability ethics, but also nursing ethics in general, related to autonomy, informed consent, beneficence, non-maleficence, etc. So for the research study, data collection consisted of non-probability convenience sampling across the 112 student cohort. audio recorded semi-structured in-depth focus group interviews that covered topics including nursing students' understanding of disability and spoken word poetry as a pedagogist, with 21 participants, 288 minutes of recorded qualitative data. The average age of participants was 21, and the majority of participants were students of color, female, heterosexual, non-disabled, suburban raised, middle income. Shout out to UIC and Chicago for diversity. Data analysis consisted of Brown and Clark's inductive reflexive thematic analysis. Due to time constraints, we'll only go into one of the three themes, and this is theme 2, facilitating engagement through affective empathy, spoken word poetry as a bidirectionally humanizing pedagogy for nursing students and disabled people. So there was so much rich data from the study, but I'm going to poem. These sub-themes were heavily represented across all 4 focus groups. Okay, so the first sub-theme was deficit, harms, and failures of traditional didactic unidirectional nursing education. So a student said, a lot of the time we're in the event center listening to lectures for up to 6 to 5 hours a day, and it's just very draining on us because all we're hearing is people talking, reading off slides. They're teaching us, so there's not really any discussion. Sub-theme B was spoken word poetry facilitating metaphysical transportation through affective empathy, feeling what someone else felt without experiencing what someone else experienced. This was the most interesting theme to me. It illuminated the differences between cognitive empathy, affective empathy, and episodic simulation. So one participant said, spoken word has this ability to, in the best way possible, I think, simulate a further and deeper understanding of another's experience without having actually done it themselves. It brings apart this different experience of just learning about something and then kind of being brought into this other world, and that level of just kind of physically and emotionally understanding more about what that experience was like for another person. So this is an example of cognitive empathy, which is deeply understanding how another person feels. And then alternatively, there's empathy, which is the ability to actually feel the emotion that another person is feeling through a process of emotional contagion. So a participant said, it's just like I felt when you were switching between singing and the spoken word. I felt the emotion, and I felt like I knew what you were going through in that time. Obviously, I don't know what you're going through, but I felt like I could feel your emotion. And then the concept of episodic simulation and being able to mentally transport oneself was also very consistent across the data. Okay. So sub-theme C was spoken word poetry as an effective, engaging pedagogy that humanizes students as active participants rather than passive objects of their education. This included themes of engagement. A participant said, when you started the spoken word poetry, like that engaged everyone immediately. The whole class fell silent and we wanted to listen. We were engaged. Another theme was visualization. That goes back to the episodic simulation. Participants described visualizing themselves with me in the parking lot when that was happening. So that was really interesting. The theme of internalization and psychophysiologic change from affective pedagogy. A participant said, when I internalized that, I came out of the spoken word different than when I came in. So that's really speaking to the power of affective pedagogy. And when an active listener feels the emotion, they're now committed to changing that, whether it's pain, anger, sadness, it's affecting them physically, and that's impacting urgency for change. So the theme of retention and care praxis, and then the theme of urgency for change. A participant said, I think what's cool about this type of poetry is that it's so empowering in a way that you don't really see with a lot of other anything really. It just fills you with like this urgency to do something about it, which is just so cool. And then the last sub-theme was spoken word poetry as an effective pedagogy that humanizes disabled people as subjects rather than objects of their care, stories, and lived experiences. So participants described the importance of having disabled people teach about disability rather than non-disabled nursing instructors teaching about it in the abstract. And then we're going to go into my final spoken word poem, which is entitled I'm Coming Out, and it delves into my lived experience with ableism in nursing education, which is happening to many disabled healthcare students across the country. It delves into reimagining the future of work, and I want to acknowledge and thank Arizona State University's Lincoln Center for Applied Ethics for funding me to create this spoken word poem. Once again, I am giving a content warning on interpersonal and institutionalized ableism, and here is a QR code to an optional access copy if reading along is more accessible to you. Okay. Hey. So this is I'm Coming Out, a poem on ableism in nursing education and a critique on the future of work. I'm coming out. No, this poem is not what you think it's about. Okay. So I took a year off after the 12-level revision spinal fusion, and switching gears to choosing a career, a couple things went into my conclusion. Firstly, personally living through the patient experience, everything from post-anesthesia confusion to learning that despite what society says, acquiring disability does not mean my life is ruined. Secondly, having been influenced by my nurse care contribution, my trust in them as healers, as some of the most dope humans. Thirdly, internalizing that the medical industrial complex demands a radical healthcare revolution, I decided to pursue nursing without realizing I'd face traumatizing disability-based exclusion, disillusioned nursing. We must do better as a profession, as an institution. So this is what happened. I studied nonstop for this really competitive nursing program, right? I make it in, nursing classes begin, and at the bottom of every syllabus, it asks us to come forward if we have a disability. And realistically, I just needed help lifting patients up in bed and an accessible seat, but after coming out to my clinical instructor, because of bureaucratic infrastructure, I was passed over to the course head who blatantly asked me why I would enter a major I was not capable of participating in physically. She handed me a list of technical standards, which was this long list of abilities that collectively would comprise the most normative abled body, and the course head legitimately said, you can't be here if there's anything on this list you can't do. Essentially, a gatekeeper saying, good luck getting through. She asked me, quote unquote, what's next? You can't even lift an IV bag? Which was insulting and untrue. That course head made it clear that disability was nothing more than a nuisance, a nursing pollutant, that it'd be easier for everyone if I were just a truant. And as a racialized, disabled undergrad student, I can't articulate how powerless I felt sitting one-on-one with her in that room, being punished for an identity I had no control over. I had to hold back tears and were strained. You really know how to make me cry. I'm scared. Scared that someone in a powerful position already made up her decision, call it forced attrition. Scared that I just spent over $10,000 in tuition to complete a very specific set of prerequisite courses for a major that rejects my body mind due to the ableist policies it enforces, fails to systematically question, and thus endorses. I was next offered a medical leave of absence by an administrator, as if made her some kind of innovator, equity illustrator. Minutes later, she said, you need a letter from your second surgeon granting permission for you to stay in the program. As if the person who knew my abilities better than me was this non-disabled white man, and my second surgeon was amazing, worthy of praising, and he said, of course you can do nursing. There are doctors in wheelchairs in case the administration needs some affirming and you don't even want to do bedside, so your BSN shouldn't be deterring. I registered with disability services who were even more uninformed on clinical accommodations than I could have imagined. I'm sorry, but I did not need or use extra time on examinations. Not being offered relevant accommodations had painful implications. After clinicals, I would have to lay down for hours, heating pads, hot showers, and additionally, ableism itself was disabling. The stress from potentially being dismissed because of my disability was unwavering. My connective tissue and endocrine disorders flared. Yes, ableism made me more impaired. My muscles were twitching. A nerve issue triggered full body itching. And you know what I lost? So much hair. There are physical repercussions to constantly being subconsciously scared. We need to do better as a profession that claims trust and care. Dear institutions, you break trust when you punish us for confiding, create safety in silence and hiding. When an institution abandons a disabled person who is most often labeled the burden, deficit actually rests in institutions that fail to generate innovative solutions didactically or clinically. What if workplaces resisted politics of disposability when beyond individual accommodations to address how unjust labor conditions produce disability mentally and physically? Crip lived experiences can transform academia and industry. They can teach us how to make disability more livable. Our survival is critical, and also teach us how to design communities and spaces, identify opportunities for changes so that we do not unjustly manufacture impairment. Let me be transparent. We must demand flexibility, fill institutionality, learn to trust radically. Like, excuse me, but people only use accommodations they need, actually. I've got to show the world all I want to be and all my abilities. Somehow I'll have to make that. I got it well in hand, and oh, how I have planned. Despite gatekeepers who exclude and reprimand, disabled people will always have more expertise about our own needs and capacities than any doctor, boss, or faculty. And one day, disability shaming will cease so that instead of coming out, we can just be. Okay, so that was that poem. So you can see how this spoken word poem, I have an entire disability education lecture that I give to nurses and healthcare educators on the differences between and synergies of disability rights and disability justice, but I'm going to keep this as succinct as possible. Disability rights focuses on institutional compliance with law and policy, and it focuses on inclusion, like anti-discrimination law and education, housing, and work. It centers white economically privileged disabled American citizens who have the access, support, and resources and time that is needed to file a lawsuit, while disability justice, on the other hand, is a very specific movement founded by Black, Indigenous, people of color, and queer disabled activists in the Bay Area that centers disabled people with multiple intersecting marginalized identities, paying particular attention to those who are often unprotected by the law, such as racially marginalized disabled people, incarcerated disabled people, unhoused disabled people, undocumented beyond compliance, accommodation, and inclusion to focus on radical transformation within individuals, solidarity, collective liberation, political education, and system reimagination. So in theory, we can have all the laws and policies in the world, but in practice, these don't promise compliance or care. So disability justice helps address the underlying attitudes that facilitate compliance with law and policy changes. Disability justice is not a theoretical framework, it is a political movement, and if you are not working with body, minds, and cross movements that are politicized, and if everything you are doing is compatible with and accepted by institutions, you're probably not practicing disability justice, but are rather more aligned with disability rights. Disability research and disability organizations need to decenter whiteness, compensate Black and brown disabled people for their labor, and engage with disability justice scholar activism now more than ever. And I'm going to end this with an invitation to an upcoming organization, the Disabled Nurse National Solidarity Collective, which is a space specifically for multiply marginalized disabled nurses and healthcare providers, and focuses on disability justice political education through facilitating engagement with disability justice scholar activism, including disability scholarships such as Akemi Nishida's Just Care, Jasbir Puar's Right to Maim, Margaret Price's Crip Space Time, Allison Kafer's Feminist Queer. If you're interested in joining the collective or learning more, please visit the website with this QR code to fill out an interest form or email disablednurse.nsc@gmail.com. And if you're able to donate, this is a grassroots disability justice organization that is fiscally sponsored through the SPM Disability Justice Fund, and donations will facilitate capacity and access for the organization to build and move. So there's a QR code on the screen if you are willing and able to donate. And finally, thank you so much for your time and for listening to my research and spoken word poetry. I absolutely love connecting and speaking with people, teaching, collaborating, generating theory, and facilitating praxis. So please reach out to me if you feel called to. My email address is sjamal20@uic.edu, and there's a QR code to my academic profile as well as my personal website, sabrinajamaladeen.com. So thank you so much to the organizers of this event, Peter, Devora, and all those behind the scenes for opening this space up to disability justice content and including disabled women of color. Y'all have been amazing. So thank you. I'll stop sharing.
Absolutely amazing. I am back. This is Tess again. I'm going to read some of the questions that we've received. The first one, you mentioned that disability justice is a political movement. Can you speak a little more on that and in what ways you think the field of disability research needs to draw from disability justice?
Yeah, definitely. Thank you. What I want to say specifically in the space of disability health research is that this has been a historically and persistently white-dominated space, and this isn't a unique problem. We see this with every movement, shifts from white feminism to intersectional and transnational feminisms, shifts from reproductive rights to reproductive justice. As people of color, if we are included in disability research or healthcare education, we're rarely included in leadership. We remain on the margins. For example, in my qualitative metasynthesis on ableism and nursing education, there was a complete absence of disabled nursing students of color. And that's because we experience racism on top of ableism, and this deepens the implicit and explicit power imbalances that are subjected upon racialized disabled people. So a lot of times when racialized disabled people make it through, it's through luck or having someone who supported them. And then I also want to bring up how important it is to avoid co-opting the term disability justice if the work being done is actually advancing disability rights. Disability justice is not equivalent to justice for disabled people or attaining legal rights for disabled people. It's a very specific political movement that opposes capitalism, white supremacy, and colonialism, and all of the manifestations of those systems. So certain body minds and certain concepts are strategically politicized across society, and they're effectively silenced because of that politicization. This includes trans body minds, colonialism, imperialism, and the genocides of Black and Brown people. So disability justice centers the body minds and concepts that are politicized. So if you're not speaking about anti-colonialism, imperialism, apartheid, genocide against all people, including the ones who are racialized, capitalism, abolition, borders, immigration, detention centers, trans body minds, fat liberation, but you're using the term disability justice, that's a form of co-opting and exploiting the disability justice movement. It's contorting it into something that is palatable, but disability justice cannot and should not be palatable. It's not compatible with existing practices. You can't pick and choose the parts of it that serve you. That becomes extractive. So just to give an example of the differences between disability rights and disability justice, the disability justice movement, including Alice Wong's disability visibility Project, Leah Lakshmi, Sins Invalid, The Collective, BIPOC scholar activists that have developed this movement hold a very clear stance opposing the mass disablement and genocide of Palestinians, but you will not see a disability rights organization or institution do that because Palestinian body minds are politicized. So if the extent of your fight for indigenous sovereignty ends at a verbal land acknowledgement without actionable calls for land back for indigenous people of Turtle Island, reparations, abolition of carceral systems, opposing the active and current mass disablement in Congo, Sudan, and Palestine, it's exploiting disability justice, solidarity, anti-capitalist politic, collective liberation. These are not buzzwords. They are rooted in action and movement. Justice movements often use the phrase, no body mind is free until every body mind is free, and that's domestically and transnationally. Borders are imaginary. This means that if you have protected identities, whether you are a US-born citizen, white, straight, Christian, middle class, formally educated, but are not using those protected identities to disrupt, push, and transform institutional boundaries for those who are persistently pushed to the margins. If your activism has not involved relationships, I would challenge you to assess your relationship to disability rights and disability justice. Justice resides in that liminal space between rights and actualized freedom, and it's a constant push toward anti-oppression and actualized freedom. It requires radical imagination of lived conditions, practices, and policies that we have not yet witnessed in our lifetime. It requires understanding the connectedness of struggle and that what does not seem to materially affect you right now will eventually, which is what we're seeing right now more than ever. And it also requires radical hope that actualized freedom for politicized, marginalized body minds can exist and will happen. Regarding everything that is politicized, from critical race theory to trans and queer liberation, to immigration justice, to anti-apartheid, to anti-genocide, the more of us who speak, the safer we become, especially during times of rising fascism. So disability rights needs disability justice in order to move theory to praxis. Yeah, I'll end that there.
Thank you so much, Dr. Jamaluddin. The next question we have, what kind of future research is needed for spoken word poetry in nursing education?
Yeah. So overall, it's clear how spoken word poetry can be useful for developing skills of empathy, active listening, storytelling. And storytelling is super relevant to all healthcare providers, but especially nurses. We're the ones collecting HPIs, history of present illness, and we are the ones relaying that to the healthcare team. So we're not only tasked with active listening, but we're also tasked with storytelling as we recall and summarize what we learn from the patients. So spoken word poetry can also help build a really important skill pertaining to processing and responding to first and secondhand trauma. There needs to be future research investigating how to ethically and effectively integrate spoken word poetry into nursing education. So infrastructure to connect spoken word poets to healthcare education, ethical compensation for spoken word poets, how to facilitate a trauma-informed approach while also confronting trauma that is inevitable to this field. Studying this longitudinally would be important, and investigating its impacts on care praxis. So how spoken word poetry and active listening and empathy can impact pain legitimization for marginalized patients, misdiagnosis and underdiagnosis of marginalized patients, diagnostic overshadowing of disabled patients. So those are areas that I want to look into further.
Thank you. I will wait a moment just to see if there are any other questions submitted. All right, I am not seeing any. Thank you so much, Dr. Jamaluddin. This is a absolutely illuminating and wonderful presentation.
Sweet. Thank you, Tess.